Good day, grade 8. Today is our MAPEH Health fourth quarter, week 4. Again, my name is Mr. Rinaldo B. Malimban. In our objective of this lesson, that the student to be able to define the emerging and re-emerging diseases. Number 2, to identify the most important emerging and re-emerging disease. Number 3, describe the current surveillance programs. Number 4, how to illustrate the epidemiological pattern and the preventive strategies of one important of emerging and or re-emerging disease. Let's talk about the emerging and re-emerging infectious diseases. So despite a new developments in disease prevention and treatment, new strains of pathogenic microorganisms have developed causing highly communicable diseases which could be chronic or fatal. So we have the chronic diseases. The one is the Leptospirosis, severe acute respiratory syndrome or SARS, Meningococcemia, hand, foot, and mouth disease, avian influenza, and also the influenza of H1N1. Let's move on about the Leptospirosis. So what is Leptospirosis? It is a pathological bacterial infection which is basically transmitted by the animals to human. So this caused by the bacteria or Leptospira. It may be present in the urine of animals like raccoon, bat, rat, mice, dog, sheep, horse, cattle, and pig. So leptospirosis is transmitted to humans by drinking or swallowing the water that has been contaminated with animal urine or through the skin contact. So what are the causes of wild disease? An individual can get wild disease by coming in contact with infected cattle, rats, dog, pigs, and other animals seen in farmhouses. So these bacteria enter the body of human through the exposed of areas of the body like the nose, eyes, or any cuts of bruises in the skin. So the leptospirosis most common in tropical areas of world, but the infecting bacteria occurs worldwide. So the risk of occupation is people who work in sewage, people who work with farm animals, people who use water from rivers or canals, or the slaughterhouse workers. How leptospirosis is spread? So people contract that disease by direct to contact with contaminated water. From the contaminated water in soil or food to bacteria in Leptospira to rodent, especially rats, up to the urine. So what are some signs and symptoms of leptospirosis? So the mild symptoms are chills, coughing, diarrhea, headache and fever, muscle pain, nausea, poor appetite, red and irritated eyes, while the severe symptoms are the fatigue, the irregular heartbeat, nausea, chest pain, stiff neck, cough, swelling of hands and feet, unexplained weight loss, high fever, seizures, photophobia, or eye discomfort in bright light. So what are some prevention in treatment? In preventive measure, we have to wearing protective clothing, like boots, gloves, and also the apron or mask, covering the skin of lesion with waterproof or dressing, preventing access to or giving adequate warning about water bodies known as suspected to be contaminated pools, ponds, and rivers, and try to avoid the wading swimming in potentially contaminated water, washing or showering after exposure to urine, splashes, or contaminated soil or water, washing and cleaning woods, avoiding or preventing urine splashes and aerosols, avoiding the touching ill or dead animals, or assisting animals in giving birth, strictly maintaining hygienic measures during care of handling of animals, where the visible and disinfecting contaminated areas like scrubbing floors in stables, butcheries, or abattoirs, or etc., and consuming clean drinking water. So in leptospirosis can be prevented by observing the following. You have to avoid using or drinking contaminated water, example water from the river or stream or swimming pool. So avoid walking or swimming in flood water, especially when you have wood or cat on the skin. Avoid also contact with the animal waste and dropping, like waste of pigs, dogs, rats, and mice. So this leptospirosis can be treated by means of the following. So vaccination, high doses of antibiotics like the biprazomicin and penicillin, intravenous fluid, dialysis treatment, and all these treatments by required of hospitalizations. So the treatment of this of leptospirosis can be treated with antibiotics that should be given early in the course of illness and possible. If you have the symptoms of leptospirosis and have been exposed to the water potentially contaminated with urine of infected animals, consult to the doctor. If the leptospirosis is suspected, appropriate the antibiotics will be prescribed. Treatment is most effective when started as soon as possible. Also, the clinician should never wait for the results of laboratory test before the starting treatment with antibiotics. Next is the Meningococcemia. So this is an acute and potentially life-threatening infections of the bloodstream caused by a bacteria called the meningitis. So the bacteria can be spread from person to person through the respiratory droplets. This disease causes blood poisoning. Symptoms of disease include fever, the irritability, muscle pain, nausea, rashes with red-purple spots, bleeding under the skin, and the treatment may include the hospitalizations and immediate the intensive care, antibiotics through the veins, and breathing support. Again, what is the meningococcemia? So the meningococcemia is the clinical form brought about the spread of bacteria to bloodstream, causing severe side and symptoms. The most devastating form of this meningococcemia or fulminant, which consists of hemorrhagic rashes, drop in blood pressure, circulating the shock leading to the death. As I said, the signs and symptoms of the meningococcemia is the fever, stiff neck, convulsion, and some of delirium, altered mental status, vomiting, cough, sore throat, other respiratory symptoms, pinpoint rashes, then become wider and appear like bruises starting on the legs and arms, large map-like bruise-like patches, severe skin lesions by lead to the gangrene, and unstable vital sign. So the treatments are the person with the confirmed of this illness, it should be hospitalized immediately for treatment with the antibiotics, because this meningococcus meningococcal disease can disseminate very rapidly. So a single dose of intramuscular antibiotic often given at least earliest possible opportunity, even before of this hospitalization. The cephalosporin antibiotics is used for confirm in this disease, and also considered of this collection of CSF for the laboratory testing cannot be done with 30 minutes of admission to the hospital. Let's move on for the hand, foot, and mouth disease, or HFEMD. So this is the relatively mild infection caused by virus called enterovirus that affects the babies and young children. Early symptoms are fever, poor appetite, sore throat, and malaise, a general feeling of illness. So the sores later appear in the mouth, palms, between the fingers, and soles of feet. There is no treatment for hand, foot, and mouth disease. Other than rest, isolations of the infected person is recommended since the disease is contagious through the direct contact with the source or with discharge from the source in the throat. So what is hand, foot, and mouth disease? Again, the hand, foot, and mouth disease are usually affects infants and children and quite common. It's a highly contagious, is spread through a direct contact with the mucus of feces of infected persons. It typically occurs in small epidemics in nursery schools or kindergartens, usually during the summer and autumn months. Next is the severe acute respiratory syndrome, or SARS. So SARS is a viral respiratory disease of zoonotic origin caused by the coronavirus, or SARS-CoV. It is highly infectious disease with no effective treatment. So the epidemic of SARS appears to have started in 2002 in the province of China, and the later spread of other countries like Hong Kong, Singapore, Taiwan, and Vietnam. So studies have shown that the SARS virus was first found in animals like the pound civet and later raccoon dogs, ferret badger, bats, and domestic cats. SARS infections can be transferred by infected people through the coughing and sneezing. Infected droplets are sprayed into the air, and one can catch the SARS virus by breathing and touching these particles. In severe acute respiratory syndrome, or SARS, is a respiratory disease in human which caused by the SARS coronavirus between the November 2002 and July 2003. An outbreak of SARS in Hong Kong nearly became the pandemic, with 8,422 cases and 916 deaths worldwide. 10.9% fatality according to the WHO. Within weeks, SARS spread from Hong Kong to infect the individuals in 37 countries in the early 2003. So the symptoms of SARS usually appear with 2 to 10 days upon the contact with the virus. The initial symptoms of SARS may include the severe respiratory tract infection, fever and headache, cough, runny nose, short throat, difficulty in breathing, diarrhea, dizziness. So people with SARS should be treated in hospital in the isolated for prevent the spread of disease. The treatment may include the antibiotics to treat bacteria and the antiviral of medications, high doses of steroids or reduced swelling of legs, and chest therapy of oxygen inhalations. Let's move on the influenza of A, H1 and N1, and what you call the influenza of swine flu. So the influenza of HI and HN1 is a highly contagious disease caused by the swine flu in Mexico. There are different strains of the virus causing of influenza like illness, like the swine influenza from the pig and the avian influenza from birds. Swine flu virus is not transferable to man. However, people who are regularly exposed to the pigs are also risks of the flu injections or infections. And what is the again in H1 and N1 swine flu? So this is the type of influenza virus that affects pig swine. It can pass to the human through the contact of air of contamination. Up to the human swine flu, symptoms include fever, nausea, and sore throat. What are the swine flu again? The swine flu is the respiratory disease of pigs caused by the type A influenza viruses that cause regular outbreaks in the pigs. Swine flu viruses has been reported to the spread from person to person, but in the past the transmission was limited. It's not sustained by beyond the 3 people. So this is the some symptoms of influenza A. We have the fever, coughing, fatigue, sore throat, headache, muscle ache, and sneezing. Then how to prevent this kind of illness? We have the healthy diet, high personal hygiene, regular exercise, and check temperature regularly. Next is the avian influenza transmission signs and symptoms of diagnosis treatment in this virus. The avian influenza of bird flu refers to the illness caused by the highly pathogenic influenza A virus that adapted specially to the birds. These are the many pandemic types of the avian influenza virus, but only in H5, N1, H7N3, H7N7, and H9N2 had been found to be highly pathogenic humans. So the spread of this disease is caused by infected poultry due to the poor of hygiene conditions and close quarters in the most area poultry farms. So this avian influenza refers to the disease caused by infections with avian bird influenza of flu type viruses. This virus occurs naturally among the wild aquatic birds worldwide and can be the effect of domestic poultry and other bird of animal species. Avians of the virus do not normally infect of humans. So this spread of disease caused by infected of what? The bird infections can change the mutate into the deadly form of infect humans. So the humans cases of avian influenza or H5N1 had been reported in Asia, Africa, and Europe. Hundreds of people had become sick with the virus. More than 60% have died of this disease. Bird flu can be transmitted for the following: farmers and poultry workers, travelers who visit affected countries, those who are touched in affected birds or eat eggs, meat or blood or affected birds, healthcare workers in contact with avian influenza. So the bird flu prevention tips are: don't come into the contact with any of the following: infected of domesticated birds such as chicken, turkey, or ducks, cage and food water containers used by infected birds, dirt or bedding used by infected birds, visiting animal markets and poultry farm, and how to properly handle and cook poultry and eggs cannot be spread in the virus. Before and after the handling raw poultry is an egg, wash your hands with warm water and soap. Cook your eggs with whites and yolk are firm. Clean cutting boards, tableware in all surface with soap and hot water to prevent contamination from the poultry. Cook chicken or poultry for more than 70% Celsius. I give you some thoughts. The preservation of health is easier than the cure of disease. That's all for today. For more updates and clarification, please send the comments of my personal messenger. Thank you. My name is Mr. Rinaldo.